Hi everyone, this is Dr. Priyadatt Patel, your go-to gynecologist from Balaji Horizon Women's Hospital, Ahmedabad. In a OPD, when patient is diagnosed with the endometriosis, their common question is, "Sir, कौन सी तरह का endometriosis मुझे है? What are the types of endometriosis?" So there is a lot of classification available in the literature and in the theories which can classify the endometriosis. But broadly speaking, endometriosis is divided into two parts. One is endometriosis interna and one is endometriosis externa. So let's understand the first part, that is endometriosis interna, because the other name of endometriosis interna, which is routinely used in the practice in a day-to-day life, is adenomyosis. And what is it? Is basically a endometriosis developed or confined into the wall of the uterus. So we will discuss regarding the endometriosis interna in another video. At present we are focusing on endometriosis externa only, or in a routine terminology it is only called as a endometriosis. So whenever the endometriosis terminology is used, you have to understand that it is mainly a endometriosis externa. So basically it's a ectopic endometrial tissue outside the uterus. It is divided mainly into the three types. One, that is the involvement of the ovary, it is called as a chocolate cyst, endometrioma or ovarian endometriosis. So what it is? Basically when these cells are deposited over the surface of the ovary, they every month go for the development, then again degenerate, then shedding, and collected over there over a period of time, produces local inflammation, scarring and degeneration along with the adhesion formation, and old blood like tissue fluid has been collected over that, and there is a surrounding covering of the endometriosis takes place. They form a pseudo capsule from the normal ovarian tissue, because the normal response of the body is to mitigate the disease process, and over a period of time they form a cyst like structure which contains dirty blood like fluid which is called as a chocolate fluid. That's why the another name of ovarian endometriosis is chocolate cyst, which is very routinely used in the community, and or it is called as endometrioma. The second type of endometriosis is called as a superficial endometriosis, where the endometriosis has been affected over the peritoneal lining of pelvic structure, and when the penetration of this endometriosis tissue inside the peritoneal lining is less than 5 mm and only the superficial portion has been involved, it is called as a superficial endometriosis. And the last type is deep infiltrating endometriosis. This is one of the most notorious type of endometriosis. They produces very extensive symptoms when it generally takes place. It is called when the depth of penetration of involvement of endometriosis from the peritoneal surface is more than 5 mm. They mainly affect the peritoneal surface over the pouch of Douglas, particularly rectovaginal septum, parametrium, bowel involvement, bladder involvement, and paraureteric tissues and ureteric wall involvement. This deep infiltrating endometriosis is even very difficult to treat, very difficult to diagnose. It is not easily diagnosed under the ultrasonography. You have to have a keen eye and knowledge regarding this to diagnose deep infiltrating endometriosis. Mainly it is diagnosed in MRI and to a further extent during laparoscopy. But high volume center like us, where we are seeing routine endometriosis patient, we know that when to suspect deep infiltrating endometriosis, and through a few of the involved structure, particularly bladder and bowel and rectal nodule, can also be diagnosed under the ultrasonography. In a routine practice, it is also called as endometriotic nodules. Very rarely endometriosis can affect the extra-abdominal organs, but they are very rare, extremely rare, not that common, so you don't have to think about that right now per se. But yes, so in a nutshell, the type of endometriosis, that is endometriosis externa, is of ovarian endometriosis, that is endometrioma or a chocolate cyst, that is number 1. Number 2 is superficial peritoneal endometriosis, and number 3 is deep infiltrating endometriosis. Why these three types is important? Because all the three types of endometriosis has to be tackled with a different way, with a different approach, and it has its own perks of complications. If you have any query regarding these, you can contact your healthcare provider or contact us anytime soon. Take care. This is Dr. Priyadatt Patel, your go-to gynecologist from Balaji Horizon Women's Hospital, Ahmedabad.